if cannabis has slightly reduced and it's being used earlier, the consistent fact about the last few years is cocaine use is starting earlier, and cocaine use is more widespread. In fact, we've had figures on that last week. So I don't think you can separate these drugs issues. They're a cultural issue, and people are more inclined to use drugs than they ever were 30 years ago. The UK's got worse than other countries, and we've got much worse than we were. I say that's largely as a result of lack of political consensus, which I've described. Secondly, we've had media-driven commentary commentating in favour of liberalisation and legalisation, which individually might not affect adults, but it does affect young people when they're making that first decision. If there are people arguing for legalisation and liberalisation, that sends a signal to some young people, well, it's not that bad. And there's been a consistent pattern of behaviour from media advocates and paid media advocacy of trivialisation, particularly of cannabis and other drugs, normalisation, and their objective is legalisation. Trivialise, normalise, legalise. That's their long-term objective.
Outside of the media, if a young person sees a friend of theirs smoking cannabis and doesn't perceive that that friend is hugely adversely affected, is that not more likely to have a strong impact on them than what? Come on,
let's get real. If you see somebody smoking cigarettes, do you see them hugely adversely affected if they're 17 years old? The fact is that the first use of a drug, it's very difficult to tell, and most people aren't that adversely affected. But we know tobacco causes all sorts of diseases. So it's about perception. But we are seeing more young people seriously distressed by cannabis. And most young people will know somebody who is what they call a pothead.